Well, good morning everyone. I guess let's get started with the session. The Beauty of Impact, I'm Thimo Schmitt-Lord, I'm the head of the Bayer Foundations and I have the pleasure to walk you through the session. The Beauty of Impact, probably some of you might question what is this all about. It's about tech pioneers who dedicate their passion and their innovative spirit to solve issues in public health. So basically the morning now is about purpose. Probably you may think, well, what is purpose? Why purpose? Why is purpose of matter in medicine when medicine is all about purpose anyway, right? I mean, to push the frontier for people health, that is purpose enough, isn't it? And in fact, when you look into the history of medicine, of top-notch medicine, to me, it's really an icon of the power of human will. I mean, it's amazing, the pace how medicine is progressing. This picture is from the late 60s. It's a heart surgery, and surgeries today probably more look like this, with robotics and target moleculing and CRISPR-Cas. We have to acknowledge that we can today do things that have never been possible before in medicine. Everything is super smart and super connected and super fast, but is there always also purpose? So what's the purpose of all this when at the same time, when we look into public health, we still see things like this, like millions of unnecessary blind cases, tuberculosis crisis in Eastern Europe, like 50 million dementia cases, and no one really has a clue how to take care about them. So, I mean, as long as public health is not really progressing, what's the purpose of having top-notch medicine? So to me, public health is ready for disruption. And when you look into, for instance, the digitech industry and how this has disrupted the way we are living just only because of the way we are exchanging data, then probably we should think about connecting tech trends to health issues to also get disruption in public health. And the 10 projects we are presenting today on stage are exactly doing right this. They are actually connecting tech trends to solve health issues all around the globe. Right, so let's get started with the first guest. It's Jeanette Grafen-Beisel. She's been actually working with me on this book project, The Beauty of Impact. Probably some of you actually got a copy at the beginning when you came in. And we'd like to talk a little about hope and innovation. Hi, Jeanette.
Hi, Thimo.
Would you like to sit down for an interview?
Okay.
Jeanette, I know besides this book, you do a lot of things. So what is it? What are you doing and why are you doing it?
I'm a German-American author living in Germany now since 1972. And yes, I write books. That's how I got to meet Thimo, because I wrote a book about men, one of them being the CEO of Bayer, and he introduced me to Thimo. And in my youth, as a daughter of diplomats, I traveled profusely, especially in South America. And as a child already, my eyes were open to the extreme poverty we faced there. And now that I'm living in Germany, I started my own foundation to help children who are, you wouldn't believe it, but there are so many extremely disadvantaged children in Germany who are abused sexually, who have violence, who are completely neglected. And unfortunately, the amount of these children is rising continuously. So when Thimo asked me to join in on this book about social innovation, that was, of course, something that really fascinated me.
So what was it? What did fascinate you? Why did you actually do it? Why did you take on this extra workload?
I took on this extra load, and it was quite a challenge. We went through weekends of writing because I find that watching the news can be so totally depressing, and reading the newspapers too, that to be able to meet and read about and talk to these innovators gives me so much hope. The world is going to succeed and we're not going to totally dissolve and disintegrate.
And I mean, having met all these pioneers, did something change for you, your view of humanity, or what did inspire you the most?
I can't say that any of the projects inspired me more than any other one, because I am extremely honored to be able to have even met them and to have been able to immerse myself into these thoughts. What inspired me perhaps the most is not only the innovators, but the essayists who give me hope, who have immersed themselves in the problems of this world, and I am sure that together, if we can find more people to join on this fantastic ride, we will be able to save the world.
Perfect. Yeah, then let's continue to do that. Next project already in the pipeline.
That's right. I have a few personal projects. I'm going to be writing 2 biographies, but we have a wonderful new project together. We're going to write a new book about innovation on the food sector, and I already heard from a few here today who are going to be joining in on this book, and I'm super happy about that.
Great, Jeanette, thank you for joining. Maybe we have time to talk then later at lunch and about your motivation and the projects.
Thank you very much, Thimo.
Now the projects on stage presenting. Thank you for being with us. I mean, maybe some of you missed the World Economic Forum or the G20 summit or the climate summit. Maybe you have not been invited, I don't know. But doesn't really matter because the best speaker of these events we have today with us, Marc Buckley, visionist and sharing with us ideas on truth in 10.
Thank you very much, Thimo. I'm going to go extremely fast, so please take out your cell phones, your smartphones, and take as many pictures as you can because I'm going to give you some free gifts in my slides, and because I'm going so fast, I would like you to go back later and kind of dive in deeper. The overview effect, or what we call sometimes the cosmic perspective, is what I want to give you. Only 500 people have seen Earth, astronauts from outer space, live. And each of them have had an effect afterwards that says it's profoundly changed their life because they saw our planet as a whole, as a ship that we're all on going together without nations, cultures, languages, or borders, that we're all in this together going in the same direction. Climate leaders like myself normally show you that in this picture for a couple of reasons. Because they want to show you the thin layer of our atmosphere and that we're a very fragile planet. But we are using this atmosphere, this very thin layer, to basically throw all our garbage into it. We're treating it like an open sewer. Every single day, we send carbon emissions or greenhouse gas emissions of 400,000 times a day. Normally the volume is a little louder and would shock you, but the amount of greenhouse gas emissions that we put into the atmosphere every single day is 400,000 times. If you were to even hear 5 times the equivalent of a Hiroshima atomic bomb, I think you would say, I think it's time for us to do something. But because we can't smell, we can't see, we don't have the effects of these greenhouse gas emissions, we kind of just ignore that. But there is an impact. An impact on climate change affects our health. Each and every one of us. Air pollution, changes in vector ecology, increasing allergens, water and food supply impacts, and many more. These numbers aren't just numbers. They're numbers that affect each and every one of us in our health and our lives. Let me give you the prime example. The Volkswagen company, right? 11 million vehicles affected or lied or on carbon emissions, on TÜV, right? Well, that number directly relates to people that died. It's not just a number. It's not just billions of dollars that they need to pay in remunerations. It's actually people, because of breathing problems, will pass away earlier in their life because of these carbon emissions. Climate change threatens your health. 250,000 deaths per year, and it's climbing. There's a book. It's called The Limits to Growth, and I'd like you to take a picture of this because I'm giving you a free digital copy of this in PDF, Kindle, Nook, and all different types of EPUB forms. This book is the Climate Change Bible, so to say, and it was published in 1972 by Donella Meadows, Dennis Meadows, Jorg Randers, and William Behrens, but it basically speaks about a number of things where they did dynamic systems thinking and modeling, where they came up that each individual, if we lived a normal, long life, we would need a specific amount of resources. And that number is 1.70 global hectares per person. But in 2017, each person on Earth is using 2.87 average global hectares per person. That is a deficit of 1.17 global hectares per person. That is something that we cannot do. It's an imbalance. On top of that, an interesting number to note is that we're losing 12 hectares of land every minute due to contaminated soil, drought, and flood. We have kind of went through and we've discovered that there are now 9 planetary boundaries that we have for a safe operating space. Johan Rockström from the Stockholm Resilience Center came up with this, and if you can see, we've already went across the border on 5 of these, where we went out of the safe operating zone and are now getting into a very dangerous aspect. This next slide shows you that there are 5 systems in our planet: the cryosphere, atmosphere, geosphere, and we basically need to be aware of these systems. These systems work in harmony, and if they're affected, just one of them gets sick or breaks down, it affects all the other ones. But they work in harmony homogenically together, so that if one has problems, the others try to compensate, but also makes them weaker. Just like our Earth has systems, our body has 11 systems, and everybody at this conference, I hope, knows about that. But it's important to get into this systems thinking, this dynamic modeling on how systems work. These systems for our body work homogenically. They work all together in harmony. There's not one system that controls all the other systems. They all work gooey, as we say, together. And this brings us to systems thinking, or dynamic modeling, which was used in the Limits to Growth book and has been used ever since to kind of mimic natural systems, to find systems, how they behave. This is a dynamic model that has to do with the fishing industry, the inputs, the outputs, the feedback loops. It's very important to realize how the systems think. These are some free systems online and that you could purchase to do your own system and dynamic modeling. Kodak is an interesting thing as far as exponential growth, and humans think linear and lateral, but they don't understand the exponential function. We're living in a world that is growing exponentially, not only population, but in climate change. 1996, Kodak was doing super, 28 billion market cap, 140,000 employees. 2012, they went bankrupt, and at the same time, April 2012, they had $1 million for Instagram, which shows that something went wrong because they developed the digital camera. This is Steve Sasson. He developed the digital camera, and he worked for Kodak, and Kodak said, how many years until this comes to market? And he said, well, maybe 7. Well, someone else beat him to it, to the digital camera, and came to the market first. And so they went bankrupt, and they actually had numerous problems. And the way that worked is through the 6 Ds of exponential framework: digitize, deceptive, disruptive, dematerialize, demonetize, and democratize. This is Peter Diamandis. The world's biggest problems are the world's biggest business opportunities. He's written several books in the Grounded Singularity University. But basically, if you want to become a millionaire, you need to help 1 million people. If you want to become a billionaire, you need to help 1 billion people. Sometimes we get confused about doom and gloom of the situation our world's in. We can see it in both ways, that the greatest health threats or the greatest opportunities are negative, or we can see the positive aspects of how we can save our planet. And here's quickly some slides that just show both sides of the picture. There are 71 markets in our world that are ripe for disruption, similar to Kodak, that are on the verge of this exponential growth and disruption. CB Insights offers these up, and here is one industry that I'm in, the food and beverage, brands of the future. These are all new, emerging, that are disrupting this industry. The healthcare industry, the education industry, the real estate industry, unicorn companies like Airbnb, Uber. Here's the hospital industry and markets that is primed for disruption. This slide is very important. It shows the imbalance in one market. It's the food and beverage production market. We have been baffled and we've been told that the oil and gas industry is the #1 causing factor of greenhouse gas emissions and problems for climate change in our world. That is not true. It is the food and beverage industry, because this is the total environmental cost as percentage of EBITDA, which is at an imbalance in food and beverage production. We are eating our finite resources. The UN has said that most businesses don't understand the Sustainable Development Goals. Because humans see the goals as a linear path and lateral, we haven't been properly prepared on how to understand them. This is a chart of how all countries are doing with the Sustainable Goals, 17 of them. United States has 0 green out of 17 and comes in 43rd place. The top is Sweden and Norway at 7 and 8 in green, and at first place is Sweden. It's important to know. Imagine a world where there's no poverty, 0 hunger, and we have good health and well-being, quality education, gender equality everywhere. There is a clean water sanitation for everyone. Affordable and clean energy has helped to create decent work and economic growth. Our prosperity is fueled by investments in industry, innovation, and infrastructure, and has helped us to reduce inequalities. We live in a sustainable cities and communities, and responsible consumption and production is healing our planet. Climate action has capped and warming of the planet, and we are flourishing. Life below water and abundant is diverse, and life on land. We enjoy peace and justice through strong institutions and have built long-term partnership for the goals. We look at the goals different ways, and this is my last slide. We need to look at them different. All of the goals are tied to food. Our basic needs are Maslow's hierarchy of needs, and we need to start looking at the sustainable goals this way in order to move forward. I'm out of time because I have more slides, but we'll catch you next time. Thank you very much.
Perfect. Thank you, Marc. Am I on air again? Yeah. Thank you for the presentation, Marc. Maybe we have time to catch up during lunch and to answer questions then. The audience is pretty big for questions. Maybe we have time for some questions afterwards or later. The next speaker to me is really amazing, because what normally happens when you stick a gap to a gap is you end up with just a bigger gap, right? But the next speaker really stick a gap to a gap and end up with a new solution. He trains blind women as medical tactile examinators, one of the fast-growing social businesses in Europe, and one of our first social impact winners in the Bayer Foundation, Dr. Hoffmann, Discovering Hands.
Thank you very much, Thimo, and I'm very happy to be here to share with you the story of Discovering Hands. How does it work? It works. Wonderful. What makes an idea a good idea? The potential to solve 2 problems at one time. Let me introduce you to 2 very big problems to human societies worldwide. The first one is breast cancer. It is the most common malignant disease for women worldwide. More than 1.7 million women are diagnosed each year, and more than 500,000 women are dying from breast cancer. This is only the number we know. Maybe the number of unreported cases is much higher. One thing you have to know about breast cancer is that the early diagnosis is very, very important. You can see on this slide how the chance for survival increases dramatically you earlier find the tumor. And on the other side, the early diagnosis reduces the costs of treatment, also very significant. The other big problem human societies are struggling with worldwide is blindness. We do have more than 4 45 million blind people around the world, and most of them, 90%, are unemployed, which means that they are facing extreme poverty. But blind people are gifted. They own an extremely well-trained sense of touch. And why not using this sense of touch to improve the quality of breast examination in order to improve the quality of early diagnosis? This is what Discovering Hand does. We have this set up a training system over 9 months, which allows blind women to become MTEs, medical tactile examiners, which allows them to make a capability, maybe a life-saving capability, out of a disability. Scientific research confirms that they are able to find the smaller lump, half the size, the standard procedure, the tactile examination me and my colleagues are usually doing, because I'm trained as a gynecologist originally. And that means they allow the earlier diagnosis with all the very good results afterwards. So these young, motivated, blind women are the real heroes of the Discovering Hand system. And the good news is that this system works all over the world, because blindness and breast cancer are global phenomena. We were able to set up a social franchise system which allows us to implement this model also everywhere in the world. We have started the process already with setting up a franchise model in Austria. We have finished a pilot project in Colombia. We will start with the support of the Bayer Foundation, another project in Mexico, and also in India. A pilot project is going on. So our mission is to make a disability become a life-saving capability. Thank you for your attention.
Fine. Can I ask you a question about Discovering Hands? Whenever I talk about Discovering Hands, everyone is always like fascinated about the idea. And people instantly also say, well, it's obvious. Why didn't someone else come up with that idea maybe earlier, right? I mean, blindness and breast cancer detection, nothing really new, right? And I like the story how you stumbled upon the idea, I mean, because you're a genealogist. So what was the dilemma?
The first was that I wanted to offer a better quality of tactile examination in my own office in Duisburg. And I was only thinking about problem solving for this specific medical office in Duisburg. And one morning, in this very creative moment, when you're not asleep anymore and not awake, under the shower, this idea came to me like a flash. And it was the same for me. I went to my computer to check it, whether this idea had come up somewhere else, but it hadn't. So I luckily are the inventor.
Very good. Well, congratulations, all of success for the further continuation of Discovering Hands.
Thank you so much.
Do you actually know how blind people read the internet? I was pretty shocked when I learned at Vienna, when we did a pitch there at 4 Game Changers, that blind people can, with the standard Braille devices available at the moment, they can only read 9 syllables, and then they have to reload. Can you imagine what a hassle it is for blind people to read something in the internet? Please welcome on stage István, the co-inventor of Braille Ring, a reloading-free Braille reading device for people reading in the internet, right?
Yes.
Stage is yours. The microphone and the presenter.
Okay, great. Hi, everyone. So at Tetragon, we are building something revolutionary for the visually impaired and blind people. For sighted people, it is quite normal that we can read, access digital text anywhere. But for blind people, they don't have the same means. Around 200 years ago, almost 200 years ago, the Braille system was developed, where characters are displayed with tactile dots in a pattern. What you see here on the left side. For a long time, it worked quite well on paper. Around 1960, in the United States, 50% of the blind people were literate. Later, technology brought us so-called Braille displays. Braille displays you connect with the computer, nowadays even with your smartphone. The dominant mechanism was developed in the 80s, where the dots are represented with moving pins. But we were shocked to learn that illiteracy was steadily growing. And nowadays it is estimated to be around 90% illiteracy rate in the United States for blind people. Well, we thought, we were really surprised and were wondering what is the reason for that. And we thought maybe today's solutions are part of the problem. These devices, Braille displays, are typically thousands of dollars. They have a limited length of text, and they are very bulky, inconvenient to use. Maybe that's why many of the blind people switch to text-to-speech, which is cheaper, but for the cost of literacy. We at Tetragon, we do it differently. Instead of having a flat line, we make a ring out of it and show the Braille text on the inside of that ring. The ring revolves, does the turns, and can basically display endless lines of text. So you place in your finger, it stays, and it turns, instead of sliding and reading with your finger. So we solve the problem of the bulkiness with the ring concept, and the cost we want to solve with considerably fewer moving parts inside. It is portable, has less parts inside, and was designed because of these. It is more robust and was designed to be used anywhere where Braille is needed. Our impact is for the 40 million people worldwide. We believe that literacy is key in preventing poverty in the blindness community and for equality, giving people back their civil rights. By the way, I left a typo on this slide. If we all would have used text-to-speech, then we wouldn't know how to spell literacy. So, but as you can see, this is reality for people who just use text-to-speech and don't read. We are an interdisciplinary team and a spin-off from the University of Technology, Vienna. I would like to invite my colleague on stage to answer some questions if we have still some time.
Sure, come, join you. Right, yeah, let's use the time to make perfect use of it. So are there any questions from the audience before maybe I have a question?
Maybe you have more questions if I give
That's
you something
so
to
brilliant.
touch.
Last time I haven't seen the prototype. It's really perfect. So what's the business case? I mean, what is next? How will you bring it to the market?
So currently we are still in development, but we want to talk to a lot of people, and that is also why we would like to use this stage to invite organizations to contact us. We are in touch with some of them in Europe, and I think it is for a lean startup very important to get in touch with those affected and in this industry early on.
So if you like to partner or invest, just see the guys during lunch, right?
Yes.
Can you actually pass the prototype through the rows, or is the only one, right?
No, this one is a mock-up and we can pass it through.
The last one, please leave it then at the entrance, yeah, because it's really very interesting to touch.
Yeah, I still have interviews in the afternoon, so I will need it.
Don't take it with you. Right, thank you very much.
Yeah.
Fine, thank you.
Well, does anyone know what the next toilet is? Not that I need one, but the thing is, in Berlin, you have about 2.5 million toilets, right? I mean, it's amazing. No one really thinks about it. At the same time, you have 2.5 billion people in the world with no access to a toilet at all. So 1,000 times bigger than Berlin, no toilet. Can you imagine how long you have to walk to reach the next toilet? So, welcome Professor Dr. Carsten Dierkes from SANI Solar, talking about a potential solution to the issue.
Thank you, Mr. Schmitt-Lord. Yeah. Okay. Let's start with some facts. Still 4.5 billion people in the world still do not have access to basic sanitation services. And of these, 2.3 billion people have no toilets at home, so that safely managed excreta. And still 892 million people still defecate in the open, which is nearly a catastrophe. And as a result of this, we can see that every 20 seconds a child dies on this world as a result of poor sanitation, which is really a big catastrophe. So what are the sanitation systems we are facing? What is the state of the art of the moment in many, many countries? It's this old latrine concept. This concept is 2,000 years old, and basically it's just digging a hole and doing the shit in, and what do you do afterwards? So that is the big problem. So that's why you have to take all these excreta out, and what do? You pollute the water, and especially you spread diseases like hepatitis, like diarrhea, like cholera, like polio. So this is a sanitation system that is too old and that is not state-of-the-art at all, and it spreads the diseases all over. So looking at some facts, you can see that, for example, there is a strong relation between infant mortality and the access to improved sanitation on this world. So what can be the solution? Looking for the 19th century, we had a sanitary revolution starting in London and Europe because of this problem. We built all the sewers, we know that. We started to build the central wastewater treatment plant, but that is not the thing for 7.5 billion people in the world at this moment. So what do we have to do in rural areas, in off-grid situations? So we developed a kind of a sanitation system, and that is not a toilet. The toilet is just the bowl where you shit in, but the question is, what do you do afterwards? So this system consists at first of a cabin. This cabin gives back the people their dignity, and it is a shelter also for the people. Secondly, we have a containment where we store separately the excreta, so that means we divide the urine and we divide the feces. And the main part of the system is that we have a treatment, and this treatment is only driven by solar energy. So we dry out the feces and we dry out the urine immediately. By the system itself, you can see afterwards, the people itself can remove their disposal and can get rid of very, very safe and clean, so that there is no danger of contamination and that there is no danger of contaminating our water courses. So the system works totally without water. You can build it wherever you want, just the only thing you need is sun. It does not use any chemicals, and it is not kind of a composting toilet. You need nothing. The only thing you need is this cabin and this engine. You don't need any electricity. Solar power just means we are just using the sun to dry out everything. We have no odors. That's very important because the flies follow the odors. So then they come into contact with the feces. So if you don't have odors, you will not have flies. So there's no transmission of the diseases by the flies. There is no need for external maintenance of these systems. The people can maintain the systems itself. So there is very, very low maintenance. The operation is done 100% by the user. So you just put it into the place, and then it can work for 10, 20, 30 years without anything that is needed. We have over 95% mass reduction of the excreta afterwards. So we just have a low material afterwards. So it is a complete on-site sanitation system for one family. 5 to 6 persons can use a toilet like this. And at the end of the day, we have a safe disposal. We stop the spreading of the diseases, and we have a nutrient recycle. So you can use the dried urine, for example, theoretically also the dried feces for those purposes. So the vision is to socialize sanitation by sustainable off-grid systems to improve human welfare and the public health. So I think we had a first sanitary revolution in the 19th century, and now it is time to start a second sanitary revolution with those off-grid systems to help the people. Thank you.
Perfect. Carsten, many thanks for presenting. We did a little market research, and there are a couple of countries in sub-Saharan world that have in their governmental goals to provide access to all the populations to a toilet in the next 15 years. And probably maybe you have the technology to it, so we can really try to scale it up.
Thank you. We hope so.
Yeah.
Yes. So we have a lot of installations in many countries of the world, starting in Africa, starting in South America and Asia. We see that the system works even under different climatic conditions, and we hope that we can spread this idea around and found more and more spots to
Perfect.
use
So
this
if anyone here would like to invest, let's talk to you right
are open to that.
afterwards at lunch. Thank you very much for joining on stage. What I love about Tech for Good pioneers is that they, think in bigger scales. When techies think about optoelectronics, they normally, think about how can we open the door more smart, things like that. But when Brian Gitta from Matibabu thinks about optoelectronics, it becomes much bigger. He thinks about having a queue for mass malaria screening, non-invasive. Brian, join us on stage.
Thank you, Thimo. Yes, I'm Brian, as Thimo said. So I want to project this picture. What you see in this picture is what actually happens in many clinics from Kampala, where I come from. Over 20 patients having to wait in long lines. I mean, with children, some of them carrying children, for just simple diagnosis, and for this case, a malaria diagnosis. Actually, a malaria diagnosis takes about 15 to 30 minutes. That's 30 minutes if you're using a microscope. That's from the time blood is drawn from the patient till when the results are obtained. This process is tedious. One, the results depend on the experience of the doctor. So if you're very experienced, you will get the results very fast and more so accurate results. But it also imposes a high cost on both the health centers and the patients. The overhead costs the clinic goes through in buying syringes, swabs is too much in the long term. And for the patient that is waiting in those long lines and having to pay for the diagnosis, it's still a very big burden to them. That's why we came up with a new kit, a new way to diagnose for malaria called Matibabu. When a person is infected with malaria, the plasmodium affects the red blood cells, as we all know. And it will change the physical and chemical composition of the red blood cells. So using light and magnetism, we're able to differentiate between a normal and an infected red blood cell. Our journey has been an interesting one. With lots of failure and lessons learned from the first prototype we had. This prototype, we were only aiming at producing light to see if the concept can actually work. Can we actually pick readings from a human body just reading light? We moved on to the second concept because we realized that with the first prototype, we were not getting actual results. There was a lot of interference from external light. But still, on testing this, the results weren't very conclusive. So we moved on to the third prototype. We actually got a pulse oximeter and we're trying to work around and re-engineer a pulse oximeter to see if we can, based on oxygen levels and all other parameters, to see if we can differentiate between a person who has malaria and a person who doesn't have malaria. So, but what we realized that with the parameters like oxygen, even your feeding will affect your oxygen levels. So the results weren't very conclusive on this. Then we moved into our fourth prototype, which is currently going in for in vitro clinical trials. And with this, we are working with light and magnetism based on the properties I told you earlier. So we're looking at having these kits in hospitals for mass screening. So you can have a robust kit in the hospital where you can carry out mass screening in the shortest time. But we are also looking at empowering individuals to have such diagnostic kits in their homes, where you can do a diagnosis at any time, anywhere, when you feel like you have a fever. So like I said, we are non-invasive, we are easy to use, meaning you do not have to have a lot of clinical experience. You can actually roll out in a very remote area where we have village health team workers that are not very educated. It is reusable, most of the kit that is in the the personal kit that is docked to a smartphone. You can use it with your family over and over again so that you track the malaria status of your children and of you as you're traveling. It's timely. Like I explained, using a microscope, it can take about 30 minutes for a diagnosis. With this, we are actually able to give you results in less than 2 minutes. Thank you very much.
How did it all start? Why did you thinking about malaria in the first place at all?
So, I mean, I come from Uganda, and malaria is a huge problem. I mean, so we started about 4 years ago, and that was my first year at campus when I was doing computer science. So I had a malaria episode at that time, and it was so heavy. So with a couple of friends, after I went through it, we were asking ourselves, since now we are doing computer science, what can we do with what we are learning to impact the community and create change? How can we start off with a small project by then that could create change around our communities? Yeah, so I mean, that's how it all started, and then evolved over the journey up to now.
Perfect. That's a role model.
Thank you.
Thank you very much. Let's stay for a while with public health in Africa. There are hundreds of millions of people in Africa with no access to health just only because they live so remote. How can that be in a world of increasing mobility and mobile services? So maybe Christian Keller has the answer with Dr. Dial.
Thank you, Thimo. It's true, access to healthcare in Africa is very limited. You have one doctor for 6,500 patients in Nigeria, and 95% of those doctors are in urban or peri-urban areas. So we're technology entrepreneurs, and we have thought, how can technology be part of the solution to that challenge that we're facing? So what we're doing at the moment, we're running Dr. Dial. That's an online portal and call center for telemedicine. From the convenience of your home, you can use the app or take a phone to have a chat, a video chat, or a phone call with a doctor. And we provide health tips as you need them. This is something we're doing it on a pay-per consultation basis. And we're also integrating health insurances. We're talking to health insurances so that they can allow their patients to use our apps. In rural areas, we want to train 10,000 doctors, nurses, and health extension workers so that they can actually give access to their patients when needed through our technology. Whenever you need a specialist, you use Dr. Dial as an access point to your patients. Dr. Dial is part of a larger vision. It's the first step towards a vision where we see a lot of apps and services in the health space for sub-Saharan Africa. We are working on some of them already. We're working on online pharmacy. We're working on a chronic disease management platform. But there's so much more potential and opportunities there. We really want to encourage an ecosystem of apps being developed, and all based on a central platform, cloud or whatever, with an electronic health record, and a database of patients, doctors, hospitals, pharmacists. I think that's pretty cool stuff, and I'm really excited to work on it. Thank you.
Yeah, really is cool stuff. I hope I'm not intimidating, but obviously you're not from Africa, so what are you doing there anyway in the first place? Where did you go?
It was a bit of my dream to come to Africa and start a company. That was like 5 years ago. And then for 3.5 years, I've been living in Nigeria, in Africa. My co-founder, Biodun Makinde, is Nigerian, and all my team is actually Nigerian. So we're a good combination, I think, of a mix of talent.
And have you been a founder already before in Germany or in Europe, or is it your first startup?
I was managing a company in Africa before, but before that I was a management consultant in Germany for 8 years.
And what would you say the biggest burden for operating a company in Africa?
Where should I start? No, the good thing is it's not the same burdens as we are facing in Western countries. Look at look at why health solutions failed in Western countries, like clouds failed because of privacy issues, because of regulation, because of heritage systems. All that is not existent there. So there we have other challenges. We have need to develop the technology, which is obviously we're developing in Nigeria. It's something that's currently our biggest challenge.
Perfect. So all of success then for continuation of the company.
Thank you. Thanks.
You have a look under your seat. Well, maybe there's a snake sitting. Probably not. But I mean, if you would live in Sri Lanka, for instance, that would have been something to do right before you sit down. Because particularly with small farmers, you see about 80,000 snake bites a year, and the physicians are always in the dilemma that they don't have enough antivenom. So who to give the antivenom, the life-saving antivenom? Next on stage is Kalana Maduwage. He's a physician, a biochemist, and a snake nerd by himself, and he has developed an answer to it.
Thank you, Thimo. Good morning, everyone. Snakebite is a major medical and public health issue in rural agricultural tropics. My talk is about a novel way of reducing the morbidity and mortality of snakebite over 300 million farmers who are at the risk in the world. 400,000 to 1.8 million snake bites occur in the world and about 100,000 annual deaths in rural agricultural world. In Sri Lanka, where I am from, we have 80,000 snake bites and 400 annual fatalities. Sri Lanka is just an example. India has the highest number of deaths due to snake bite, which exceed 10,000 deaths per year. As a neglected tropical disease, snake bite has many issues to address while confronting the burden. Not enough antivenom available in some part of the world, and most of the antivenom used in the tropical countries have unexpectedly high reaction rate, and significant proportion of them are life-threatening anaphylaxis. It is clear that some of the deaths occurs due to the antivenom reactions, not due to the effect of the snake venom itself. As for any other medication, antivenom also should have clear indication for the administration, and more importantly, as this is one of the most dangerous medication used in the world, the use of antivenom should be based on the analysis of risk and the benefit towards the patients. Current practice is to wait until the patient develops clinical features of effect of venom, and that is too late to be reversed by administration of antivenom. Therefore, it is critical to detect venom in the patient's blood before the patient development of any clinical effect after the snake bite. This is very important to administer antivenom to prevent the organ damage, but unfortunately, so far there's no such test available in the world. I developed a rapid venom detection test for the first time in the world, and results were published in the journal Nature Scientific Reports. This test detects the common snake venom toxin called phospholipase A2. All venomous snakebite patients had higher toxin levels than non-snakebite people. Moreover, this toxin concentration was well correlated with the actually measured the venom concentration in the patient blood. I proved this is the basis of a rapid venom detection test in the world. My plan is to bring this device close to the patient within the next 2 years. This device will work as urine HCG testing strip on the diagnosis of pregnancy. As a medical researcher from Sri Lanka, this is a big challenge for me to develop a rapid enzymatic device with the limited resources available to me. This novel concept was appreciated by 2 Australian and 1 North American award as the best scientific discovery and the finalist of the Aspirin Social Innovation Award offered by the Bayer Foundation, Germany. This rapid venom detection device will diagnose the presence of venom in the very early stage at the bedside, even before the patient develops organ damage. This will be the test to decide initiation of antivenom only for the necessary patients. Therefore, the deaths and complications induced by antivenom itself will be cut down. Finally, this test will reduce the burden of snakebite in rural farming community which is about 300 million people who are at the risk for snake bites. Availability of the rapid venom detection device will revolutionize the treatment of snake bite in the world in the near future. At the moment, I'm searching for financial and scientific support to bring this device close to the patient as soon as possible. Thank you for your attention.
Oh, Kalana, I have a question. Is it actually true, or did I make it up, that you as a child went to the jungles to milk cobras to get antivenom? Is that true?
The thing is, I was fascinated about snakes since my childhood, and at the moment I'm continuing my medical research on venom and antivenom and things. And in Sri Lanka, we had no place to buy venom to do research, therefore I had to keep snakes at my home and milk by myself, and I had 3 snake bites during my life, but fortunately none of the bites were actually dangerous, or I was lucky to be survived. And at the moment I'm continuing my research on producing a new antivenom to Sri Lanka, parallel to this new venom detection test. Thank you.
Well then, safe research.
Thank you.
Yeah. By 2050, there will be 130 million people with dementia living on Earth, and how will it ever be possible to take good care of all these people when the systems are on the stretch already today? Maybe by the application of smart technology. Mary Matthews will talk about Prompt, a dementia app, Pia, right?
Hello, everybody. Our mission at Memrica is to help people in the early stage of dementia to retain their independence, to feel good about life, so they can be the person they want to be day to day. As Thimo said, the numbers living with dementia are expected to be a tsunami. The cost is expected to double by 2030. Governments around the world are worried about the cost and how they're going to sustain it. And so it's no surprise, with no cure on the horizon, that attention is turning to early intervention and even prevention. Recently, the Lancet Commission in the UK published a report that suggested that 1 in 3 cases of dementia could be prevented by lifestyle changes. Better diet, more exercise, better education, reducing hearing loss, and maintaining social connectivity. The issue for people with early dementia, though, is that they often become so anxious about forgetting things, about being embarrassed by getting things wrong, that they start to withdraw. They become isolated and depressed, and that makes their memory problem even worse. And so that's why we're creating Prompt. It's a smart memory assistant that works just like memory. So when you think of someone or a place you know, you have a whole host of connected information at the back of your mind. We're replicating that in technology by gathering data about people and places that are important to the user, and then connecting that information to photographs to produce a little profile. Those profiles then are attached to reminders. So if, for example, I know I'm going to meet John for coffee because I have a reminder, everything I know about John is in one place for me. How we met, what we normally talk about, who John knows that I know, the fabric of social conversation that's so important to feel as if you are part of that conversation. Over time, the system will learn from your pattern of behavior what you do normally, and it will begin to predict what information you need and bring that to you in advance, so potentially you don't even have to set a reminder. Also, after every event, the system will come back to you and say, how did it go? This helps the user embed that memory, but it also continues to build those profiles behind the scenes. We'll be integrating this system into today's smart digital assistants, Alexa, Google Assistant, Siri, which are brilliant at telling you things that are already online. So, what's the weather like in Berlin today? Or when does my flight leave? When do I have to leave here to make my flight? They're really not so good, though, at telling you the really personal information that is that fabric of conversation. Like, what's my neighbor's husband called? Or What did I get my niece for her birthday last year? The kind of things that actually are so important for day-to-day living and confidence. You may know that there is a dependency scale. So 0 is when you have no dependency at all, right up to 7, which is when you are fully dependent. Most of the cost of dementia is for people who are towards the end of that scale. Some research by Trinity College in Dublin suggested that if you can stop people moving just one step along that scale, you can save 7% of care costs. Some other research shows that if you can delay brain disability by 5 years, you can halve dementia costs. But of course, it's not all about cost. It's also about quality of life. For someone like Roy here, who's one of our users, he feels that having an app in his pocket gives him dignity. He's not dependent. It's like having a friend with him all the time. And for Roy's family, it makes them feel good. It reduces their stress. They know that Roy is okay and he is engaging with his community and he's seeing his friends. We're at the beginning of our journey. The app is on the App Store if you'd like to download it and try it. It's the first version, and we're continuing to work to improve it. If you'd like to have a chat with me later or help us on our journey, I'd be really pleased to talk to you. Thank you.
Many thanks, Mary, for presenting. I mean, technology seems to be ready. Market pressure is there. Do you have plans also to translate it into other languages or to scale up in new countries like France or Germany?
Yeah, so the challenge for any technology where we're using natural language processing in part of it is to find the right interface for different languages. So the simplest version, I think we could easily translate into other languages. And that's just a localization task, I suppose. But some of it, which is more complex in terms of finding information when you need it, that actually will take a lot of work. And actually, you know, it's a long-term vision. So if anyone here is interested to help out, I'd be delighted to hear from you.
Thank you, Mary.
Thank you.
Did you actually know that developing a cervical cancer in sub-Saharan Africa is 7 times higher compared to Europe? But how can that be? It's because of the poor application of gynecological tests in principle. And the next speaker, Margaret Nonzombie, has developed HerHealth. It's a smart app tool, and what it does, she will present to you herself.
Good morning. My name is Nanyombi Margaret. I'm from Uganda. It's a part of Africa. I was raised by a single mom. She worked at a post office at that time. And I used to always visit her office after school. And there I was exposed to computers and the internet. So I was determined to be an engineer when I grew up. Unfortunately, at that time in my community, subjects in STEM were not an option for women. Most of the girls were raised to take on arts and history subjects to prepare them for careers in fashion and administrative subjects. So I was determined to do something in technology. And that's when I decided to apply for a course called Information Technology at the university. So we had a chance to do go and do needs finding in our district in Mukono, in one of the rural communities. And there we learned that at least 40% of the women around the world have bacterial vaginosis. And of these 55% are asymptomatic. And you can find like 1 in 3 women actually has bacterial vaginosis, but they don't even know it exists. In Mukono district, we happened to find one Safina. She's a mother of 3 kids, and we asked her how she's able to take care of her health. She told us a basic urinalysis test is not even an option because it's an equivalent of what? A week's worth of food for her family. In many communities in sub-Saharan Africa, women stay even 6 miles away from their nearest health centers. So going to the hospital is not an option, and they only wait until their infections worsen to seek medical attention. This is because of the high cost implication and distance in accessibility to reproductive health services. Then for the girls like me in the pre-urban areas, we are shy to go and talk to male doctors about our intimate health issues, mostly because the male doctors are the dominant in the communities where we come from. Like I told you, STEM is not an option for girls. Those subjects are looked at as subjects for boys. So our team sought to create a solution for women like Safina who don't have an option to access reproductive health services at their convenience. So what she does is collect a urine sample in a clean pickup, place a hardware which picks values of her urine sample and sends them to the mobile phone application, which computes and sends them to the mobile phone application as results she can interpret. In return, the application advises her on whether to see a doctor and where to find a doctor in an area of her vicinity. So we plan to make this available at level 1 health centers. That is for the rural communities where women may not be able to afford the hardware. And then in the pre-urban areas where girls like me may be able to afford the smartphones and probably the hardware, we shall ask the doctors to recommend this so they can use it in relation with their doctors to advise them on when to go in for further testing. Then for women who may not be able to afford the hardware, we plan to partner with NGOs dealing with reproductive health services so that they can make it available at a subsidized price. And then we also plan to partner with governments like Ministry of Health to make it available in districts that are not accessible. We've so far raised $40,000, with which we've done needs finding, like in Mokono district, where we reach out to different communities and learn their challenges in accessing services, health services. We are working on a third prototype, which is targeted to a 90% accuracy, shareable and reusable, so that the women can test at their convenience in their homes. We are also working on a telemedicine platform that can allow the patients to send their results remotely. Then the doctor can advise them whether they should go in for further testing or advise which medicines to buy in their nearest pharmacies. So far, we are working with 4 gynecologists in Kampala district who are helping us test the prototype. We have piloted in 3 health centers who are testing the telemedicine platform, and I'm currently based in Chile, where we are planning to also launch the telemedicine platform and do clinical trials. We believe we are the best team to do this, especially because we believe we are the best team to do this because we are in an area where we understand the solution, the problem, more than anyone else, and no one can better create a solution other than someone who has gone through it. And with a technological background and passion to create linkages to affordable and tech solutions in low-income communities in Uganda and beyond, we ask you to join our cause to empower women around the world to take their health into their own hands. Thank you.
Thank you, Margaret. Did you know that actually 65 million people are displaced these days, according to the World Health Organization, right? Yeah. And that these people are, I mean, what they look for, they need shelter, safety, and medical aid, right? But how can a doctor ever be able to talk to so many people in so many different languages? In the hotspot zones of refugee aid. Harald Neidhardt has developed a container solution with an on-demand translation system, Container for Good. Harald, good to have you here.
Thank you, Thank you, Thimo. I want to talk to you about a solution we developed in the summer of 2015. When we came, when you remember, 2015, a lot of people came to Germany, around maybe 1 million people who are refugees coming from distressed areas, war zones, and so on. And one of the biggest challenges was the language. Besides finding a good place and safety, that people who had to talk to doctors couldn't really translate and couldn't really communicate. So we came up, my friend Mirko from Cisco called me one day and said, hey, can we do something with Wi-Fi and some of the technology? What can we do? And I really looked at how they were treated at the German, or in Hamburg, where I'm from, the main station. And there was really like a triage, no floor in it, was raining. There was a doctor as a volunteer for just 1 hour a day, and he said, okay, who's next? And there were 20 people waiting, and it was really like a bench, a couple of blue gloves on the right, and a little bit of an orange defibrillator on the left side, and it's like, hey, welcome to Germany. And I thought that's not really cool. So I said, hey, Mirko, why don't we think about a container, because we work actually out of a co-working container space, which we developed. And so we can have a doctor's office. It's much more convenient, can be safe, can be hygienic, can be cleaned, as well as a lot of storage, plus security at night. So what we developed is, on top of the container sketch you saw, which within 6 weeks we developed the whole clinic together with the University Clinic of Hamburg and the Red Cross. And the main feature here was is a pointer? Here. So there's a terminal, and with this terminal and the company which we partnered with from Vienna, we could translate 50 languages within 1 or 2 minutes. So within 1 or 2 minutes, we could have a real person beamed in basically into the container and speaking 50 languages. So there was a network of 750 translators where we could say Tigrinya, Urdu, Pashto, Arabic, all the new German dialects, and that yes, and that helped really the practicing doctors. So like the Professor Scherer here, and so opening up the language really started the communication, because really it's a quick 5 minutes out. But the normal way was that there was maybe 4 people sitting there for the 4 main languages. But if the Arabic speaker was sick, well, there was no Arabic translation this day. So we could overcome this because of the multitude of speakers as well as a multitude of languages. We could increase the quality of the talk, but we could dramatically reduce the cost, because we reduced the annual cost by $170,000 times 10 containers, which we have in operation in Germany. We saved the city about $1.7 million. So I think we can bring this to other places in the world, because if we are after we did the first container and we did a little bit of a rollout, we got a lot of recognition, including we're thankful for the Aspirin Award. But the idea is, well, we have now 10 containers in Germany together with the Otto Foundation. They helped us to set this up in Hamburg. But obviously, if you're really lucky, now the situation is much better in Germany. You can dial 110 or 911 and you will be helped, and translation is obviously very important. But I think we can take the system or this kind of notion and thinking, how can we bring better healthcare and high tech in a mobile way to where help is needed most. So obviously last year was also a big, still the Greece border and everything around Syria, Lebanon and so on is really still affected. A lot of the people are there, millions, 3, 4, 5 millions, a lot of them still in Lebanon as well, trying to go to Greece or now to Syria, to Italy. So at these hotspots, so we actually brought 2 containers to Greece, well, 1 to Greece in Samos, and 1 to Lebanon as a pilot project to see if we can help there. And there probably we're not talking language, but much more about telemedicine. So we can bring in doctors, can we bring in other services to help and assist the people who are local. So if we have a staff, which is maybe a nurse or somebody from Doctors Without Borders, we think we can bring in experts and help in this way. So one project we're working on right now, and I like to see if somebody can help me, we want to bring an X-ray clinic to Sicily. So we are in touch with the local community there, and the people really want it because, as you know, we all need X-ray screens if they come to. They need X-ray screens if they come to Europe. But they actually look in the eyes and, you're probably not affected, so we don't do the scans. So we want to bring this together with a team from Finland, which has 90 doctors remote. They can do remote diagnostics for X-ray, but on top we want to add Watson so that we can have AI looking at the diagnostics within milliseconds, and so that we can bring high tech to where this is needed, and we can train Watson to run into tuberculosis. So this is how it will look like, and hopefully some of you can help me. We're looking actually for an X-ray version, X-ray unit, so that we could run a pilot with Watson in this regard. hopefully you can support us. Thank you. Thank you, Thimo.
Thanks, Harald. I mean, we heard earlier this morning already what global threat breast cancer is and how important it is, like, to have early screening available. And it's not a big surprise, but sad though, that 70% of all breast cancer death cases are reported from low to middle income countries because of the lack of mammography available in these countries. So wouldn't it be just a beautiful world if, like, early screening would be available everywhere on the globe? And maybe Baumik Sangvi have a solution with eye-breast exam.
Thank you, Thimo. First of all, let me thank you on behalf of all the innovators here to giving us this platform to showcase the innovation. Thank you. Making breast cancer screening accessible, affordable, and scalable. Before talking about our innovation, I would want to tell you about the scenario which everybody knows, the breast cancer scenario. 70% of breast cancer death occurs in developing countries, out of which 66% are detected at late stage. Breast cancer is the leading cause of death and disability among women, and especially young women in low middle income countries. In last 2 decades, the incident rate in developing countries has doubled. It is increasing annually by 2 to 3%, where in developed countries, the incident rate has plateaued. Less than 1% gets breast health check in low and middle income countries. Less than 1%. Due to which there is poor survival rate, because there's no detection, there's no early detection, late detection, which is very poor survival rate. The survival rate in India is 50%. Whereas in UK and Europe, it is 80 to 90%. Now there is a problem. We cannot adopt the current gold standard and implement it in developing countries. There are many points I would like to showcase that. The first and the most important point is radiologists. We have 1/10 number of radiologists compared to developing countries. And those radiologists are not enough to perform a mammogram test. Second point is mammogram uses X-ray. Women despise X-rays. Anyone would despise. Any healthy woman would not want to undergo a painful and a radiation test. This is the biggest problem we have seen in developing countries, in urban and the rural part, where women don't come forward for any type of screening if it's done by mammogram. Third point, dense breast. X-rays cannot penetrate in dense breast. The performance of mammogram is as low as 50% in dense breast. So young women and women dense breast cannot get a mammogram or cannot get an accurate report or result. Last, the cost. The most important thing is the cost. The cost of mammogram is so expensive that it cannot be implemented in developing countries. Developing countries have many other issues where they're spending money, but even a $40 per mammogram is very expensive for a public health service. This is a conundrum, a real dilemma. How do we do it? What is the way out? We cannot implement the Western standard, the current gold standard modality in developing countries. What is the solution? It took us 7 years to answer our question. You need a tool which is ultra portable, which is handled, non-invasive, no pain, easily used and operated by community health workers, and instant report, and efficacy as good as your gold standard. This is the innovation eye breast exam. It is ultra portable. I just wanted to show you. This is the device. It took us 7 years to make this device. It is very quick, easy to use. There's no radiation, no pain. And you can train health workers within a day to do a scan. This image was taken at a village called Gadchiroli. It is the ruralist Naxalite tribal area in India. When we went there, we learned that even in Gadchiroli, in a rural part of India, breast cancer, late detection of breast cancer is a concern. The doctor there told us normally breast cancer was detected by the partners. Now we are happy to say that our device is being used in Gadchiroli and it is making early detection accessible. We have done over 75,000 tests across India, Myanmar, Botswana. Over 100 plus early detection cancer has been detected. We have US FDA, CE mark, other approvals. We have published 4 clinical data. Sensitivity is 84 to 86%, our specificity is around 94%, and negative predictive value is around 98%. We have raised $4.3 million in equity. We got 1.3 million grant, with which we were able to commercialize our device. Right now, we have 50 plus employees all across 3 countries, US, India, and Malaysia. These are our partners who have helped and supported us in getting our device commercialized. Global scale-up plan. As I've told you, we have already implemented the program in India, Botswana, and Myanmar. Recently, we tied up with GE Healthcare. GE Healthcare is going to take our device and market in developing countries like Africa, Southeast Asian countries. And we are also entering South America, Mexico, and Brazil. Thank you.
Great. Thank you for sharing this perfect device with us. So now, coming up, the last speech of this session, actually largely unknown to most of us, particularly I didn't have any clue about it. Scoliosis, the abnormal curved spin condition, is still a major health issue with 14 million people suffering from it. How can that be? Maybe Akansha Vyas can talk to us a little about how we can change that in the future.
Thank you, Thimo. Hi. I'm Akanksha, and I'm here to tell you a story about a 10-year-old girl called Sarah. In the year 1943, Sarah was diagnosed with scoliosis. It is a spine condition where her spine was growing abnormally. And as a 10-year-old child, she had to get this brace that she had to wear for 18 hours a day. Well, to get this brace, she had to go to this lab where her entire body was wrapped in a plaster cast, and then that was cut with a saw. That cast was then used to hand mold the brace for her, and it was this bulky, uncomfortable final product that she absolutely hated. In the year 2013, Sarah's granddaughter was diagnosed with scoliosis. And the crazy thing is that she had to go through the exact same prescription process as her grandmother. And that isn't even the scariest part. In most of the world, this treatment isn't accessible. This means that either patients have to get surgery, where the doctors take a metal rod and fuse it to their spine, or they just live out the rest of their lives with a bent spine. And this is actually what happens in most cases. So Sarah and her granddaughter are just a couple of millions and millions of people who experience this. In countries like Europe, many of the European countries in the US, about 70% of the people who have this disease are not diagnosed in time, which means that they do not get the bracing treatment. When you go to countries like India, Africa, and other developing economies, this percentage goes up to 95 to 98%, which means that over 25 billion new patients every year, 10 to 12-year-old children, go through this process every single year. As Thimo mentioned earlier today, we have the technology to do things that we never ever had before. And at FIRID, we are building technology to change this 100-year-old process and help all of these people. We start with an app for scoliosis awareness and early screening. We're going to distribute this app across the world for free to enable teachers, parents, and anybody really to scan for the early signs of scoliosis and connect patients with doctors. Our mission to make sure that every child between the ages of 10 to 12 everywhere in the world is aware and screened for scoliosis. Next, we are able to completely replace the traditional plaster casting process with just a couple of pictures from a smartphone camera and x-rays. So in the artificial intelligent design system that we have, in the artificially intelligent design system that we have built, you feed in the pictures and the x-rays, and it spits out a 3D model that is unique to that specific patient and their medical condition. Essentially, we're training the computer on the skills of the craftsman to make sure that we can make the most accessible, comfortable, and accurate treatment available to everybody in the world. And we are going to go beyond scoliosis to do this. So today, our scoliosis brace is being tested in 3 hospitals across the Netherlands, Turkey, and India. But as we go forward, we will apply our technology to wrist braces, arm braces, prosthetics, and so many other products that have the same 100-year-old prescription and accessibility problems. And so with that, let me present to you our first product, the 3D printed scoliosis brace. It is very lightweight, flexible. I can like bend down in it. And our patients absolutely love it. Thank you.
And looks stunning.
Thank you. I like it.
Thank you for presenting. That's about it. I hope we didn't overwhelm you with all these ideas. I was just, in parallel calculating. I guess when you actually just calculate the entire impact of all the 10 projects that have been presented on stage, you end up with 3.6 billion potential people that could benefit from these innovations. That's massive. So, and that brings me back to like the entrance statement. Any innovation is only as good as the ecosystem in which it operates. So if we actually have top-notch medicine on the top level, it will not really reach the level of impact it could when the basic health is not working well. And all these tech pioneers who are presenting today on stage just give us a feeling how innovation could actually progress basic health to reach the millions. And that's probably the most important actually we have to do to bring health on the next level on the mass scale. And therefore I'm really take pride to say this was really an opportunity for us as a foundation to support all these pioneers. Without the pioneers, foundation would only be like a bank account. We couldn't achieve anything with our money without people who turn money into impact and innovation. And therefore, thanks a lot to all the presenters. Grab a book when you go out, because there is more to read about these innovations in the book. The Beauty of Impact. I hope now maybe you understand why we choose this title, because it's so beautiful actually to do social fiction instead of science fiction. Science fiction to me is like the world how it would like when we apply technology. Social fiction to me is the world how it looked like when we apply technology to solve issues and challenges of humanity. Please, all the speakers, come back on stage so that we can have a group photo and maybe some applause for the presenters.